Hello guys, today I'm going to tell you about the one of the diseases that classify in sexual transmitted disease, which is syphilis. So without any delay, let's jump to our topic today. So what is syphilis? Syphilis is kind of a sexually transmitted disease that is mostly caused by spiritual treponema pallidum, and there are three stages of syphilis. The first one is primary infections, that we can see that the patient may have uh, cancer, and for the second stage is sometimes the patient may have diffuse rash, and for the last stage is tertiary infection. Mostly the patient might have symptoms related to cardiovascular disease, which is aortic insufficiency. For the next part is microbiology. So the syphilis is caused by the spirochete, one of the bacteria that we call it Treponema pallidum. It is a causative organism of syphilis, and it was discovered in 1905. It is a bacterium spirochete Treponema pallidum, that the shape of it is corkscrew shaped with round spiral, like as you see in the pictures. And for the next part is epidemiology. So from the 2000 to 2018, the primary and secondary syphilis cases was increasing in men who have sex with men, or we call it MSM. MSM was estimated at around 54% of all primary and secondary syphilis cases in 2018. And there are some risk factors for this, like methamphetamine or having acquired a sexual partner, social media. And the data also stated that the number of syphilis occurred in women have been also increasing from 2013 to 2018. In additionally, there also have been increasing number of cases of congenital syphilis, and for the patient that have healed also is associated with syphilis, and 42% of men sex with men with primary and secondary syphilis have healed, compared with 8% of men who have sex with women and 4% of women. So the next part is transmission. For the transmission of Treponema pallidum, is occurs via direct contact with infectious lesion during sex, and the material of syphilis Treponema pallidum also across the placenta and also reside in congenital syphilis. For sexual transmission can be exposed to the organism when there is open lesion with primary cancer and with secondary syphilis like mucus patches and condyloma lata. And this lesion is very contagious with around 30% of efficacy. The patient with latent syphilis can be infectious, and when there is a lesion that will miss on the initial evaluation. Syphilis also can spread by touching or kissing a person who have active lesions like blister on the lips, oral cavity, brief or congenital. And syphilis is sexually transmitted disease. They can be also associated with HIV. So for pathophysiology of syphilis, the bacterium Syphilis Treponema pallidum can get access in the early local infection to subcutaneous tissue via microscopic aspiration. The spirochete can provoke the ulcerative lesion by the host immune system. That those ulcerations is called cancer lesion. During this time, some organisms also can spread to regional lymph nodes, which are in lymphoedema, lymphoadenopathy, and Treponema pallidum can stimulate the host system. That we already know that there are two host systems in our body, innate and adaptive. So those those two things was stimulated by the treponema biodome, and Umra immune also respond to this and lead to development of a variety of antibodies that can be detected early in the course of Syphilis. So for the lead infection, the partially immune hypersensitivity host may react to the presence of the polymer, so it created the chronic inflammatory response. So the result is the patient have gumma or lead-binding syphilis that often is attacking the skin, viscera, and other tissues like bone, brain, and abdominal viscera, and it is characterized by the presence of granuloma that is resulting from the consistent with cellular hypersensitivity reaction. And in the late stage of the syphilis, the bacteria affect the cardiovascular system, that the patient might have this is related to aorta or aortic valve due to vascularity of the vasa vasorum, or we call it arteritis obliterans. And for the stages of the syphilis, there are two stages, like early and late stages. For early syphilis, in this stage, the patient have primary and secondary syphilis that occur within weeks to months after initial infection. As well as early latent syphilis, asymptomatic within 12 months. For late syphilis, in the patient who are untreated and progress to late latency, the patient is asymptomatic and the patient also can develop to major complications like tertiary syphilis. The duration of the fast may appear at any time from 1 to 30 years after primary infection and can evolve to a wide variety of different diseases. So in this state, the patient might have neurosyphilis, which is characterized by the sign of the central nervous system manifestation. And for the clinical finding, in early sign, primary syphilis, or we can see the patient might have a canker lesion. There's a localized skin lesion, or we call canker. There is a curve around 21 days, around 3 to 9 days in a mean. The lesion is papillary, painless, and shortly become ulcerate size around 1 to 2 centimeters, ulcer with the rest in the directed margin. And the lesion may be associated with regional lymphedema, and it is often bilateral. A canker lesion can be healed spontaneously within 3 to 6 weeks in the absence of treatment. For the secondary syphilis, it progresses within weeks to few months after a canker lesion. 25% of patients with untreated infection develop a systemic disease. And secondary syphilis can also heal by itself without treatment, except in the case of severe cutaneous ulceration called pneumonia, like you see in the pictures. Occasionally, the untreated patient can relapse up to 5 years after their initial episode. Secondary syphilis can be presented with a variety of signs and symptoms, like generalized symptoms, constitutional symptoms. The patient might have fevers, headaches, malaise, anorexia, sore throat, myalgia, and weight loss. And it can result from the widespread dissemination of Treponema pallidum. For adenopathy, secondary syphilis have lymph node enlargement with papillary bone nodes present in posterior cervical, ciliary, ganglia, and femoral region. The epithelial clear nodes are partially recessive of myalgia. These nodes are generally minimal, tender, firm, and rubbery inconsistency. For dermatology finding, the patient might have rash. The rash is diffuse, symmetric nodule or papillary eruption in both thyroid tract and extremity, including paw and sole. In patients with HIV, the more severe ulcerative form of secondary syphilis termed pneumonia have been reported. For alopecia, it also called mud-eaten alopecia. This may be noted on the scalp, eyebrow, or birds, and easily reversible with treatment. For gastrointestinal finding, the patient might have hepatitis, Syphilis hepatitis characterized by the high seromarketing postmortem, labeled on laboratory examination. Mild clinical hepatitis resolved with treatment. For gastrointestinal abnormality, the patient might become intensely infiltrated or threatened. This can be misdiagnosed as lymphoma. And musculoskeletal abnormality, the patient might have tendinitis, arthritis, and periostititis can occur but resolve after treatment. For renal abnormality, the patient might have nephrotic syndrome or menorrhea or acute nephritis with hypertension and acute renal failure. So pathologically, membranous glomerular nephritis, sometimes with crescent, can be seen. Neurologic ocular finding, head age, invasion, and of the cerebrospinal fluid is common in early onset disease, or menang and vascular manifestation like meningitis, meningococcal disease, or stroke. Ocular finding, anterior uveitis, posterior uveitis, or bronchitis, which is often granuloma. Posterior uveitis typically present as multifocal chorioretinitis. For late syphilis, around 25 to 40% of patients with angiotic syphilis can develop the late disease. The clinical may appear at any time from 1 to 30 years after primary infection. So, like I mentioned above, this late syphilis is often associated with cardiovascular system, or we call it cardiovascular syphilis. The patient might have bronchitis, most commonly, or rheumatic syphilis, granulomatous cellular lesions, which are rare. They can occur in many organs, usually skin and bone. Also, central nervous system involvement, particularly general paralysis and tabaxi. Tertiary syphilis is stage and is involved the cardiovascular system or rheumatic disease. For cardiovascular system, it involves the ascending thoracic aortic, resulting in dilated aortic and aortic valve dilatation. It may also due to vascularity in the vasodome, leading to weakening of the wall of the aortic roof. Typically, it occurs 15 to 30 years from the initial infection in the angiotic patient. Similarly, aneurysms rarely lead to resection. Chest feels so calcified ascending aortic of the aorta, reflecting the chronic inflammation of the tumor. Syphilis may also associate with coronary arteries, resulting in coronary arteries narrowing and thrombosis. For rheumatic syphilis, is very uncommon. Rheuma can occur anywhere, including skin, bone, or internal organ. The lesions have round auricular serpiginous septs with a rheuma may present as mass lesion. For central nervous system, it occurs as many 25 years after the initial infection, general paralysis, and tabaxi. So thank you to all of you for spending your precious time watching this video. I hope you guys can get something from this video, and I want you to go to my website, which is helpthattime.com, to see more useful content related to higher education. Thank you for watching.